PSA stands for prostate-specific antigen. It is a common blood test that doctors order to screen for prostate cancer and/or monitor the progression of prostate cancer. Prostate-specific means that PSA is only produced by the prostate. However, PSA is not cancer-specific. Other conditions may cause an elevated PSA. There are several conditions that may cause an elevated PSA. This includes benign prostatic hyperplasia, which is a non-cancerous enlargement of the prostate cancer, urinary tract infections, prostatitis, which is inflammation of the prostate gland, instrumentation, such as recent cystoscopies, catheterizations, or surgeries on the prostate, sexual activity, or even riding a bicycle. The normal cutoff value for PSA in screening for prostate cancer has traditionally been considered to be 4.0. However, there is debate about this cutoff value. For example, in a recent study, researchers proposed using PSA levels of 1.5 as the cutoff value. In addition, there are age-specific PSA cutoff values. That is, as men get older, the normal PSA cutoff value is considered to be higher. If you have an elevated PSA, the first thing you can do is get a repeat PSA test to confirm your PSA test result. If your repeat PSA test yields the same results, your urologist will traditionally recommend a prostate biopsy. However, as not all patients with elevated PSA levels have prostate cancer, unnecessary biopsies can introduce significant side effects and complications such as pain, bleeding, and infection. Because of this, you can complete a secondary biomarker test to help determine your probability of detecting cancer and your probability of having an aggressive prostate cancer before getting a biopsy. Finally, if your secondary biomarker test results indicate a high risk for developing aggressive prostate cancer, you may consider getting a biopsy of the prostate to exclude the possibility of prostate cancer. There are several secondary biomarker tests that are currently available to you. SelectMDx is a urine test that screens for 2 cancer-related genes and requires a digital rectal examination of the prostate right before collecting the urine sample. PCA3 is a urine test that measures the concentration of prostate cancer gene 3 to determine the need for repeat prostate biopsies. This test is for patients who have had a previous negative biopsy. It also requires a digital rectal examination of the prostate with a prostate massage before collecting the urine sample. MI prostate score is a urine test that looks at the amount of serum PSA along with the amounts of 2 prostate-specific cancer genes. The 4K score is a blood test that measures the plasma levels of 4 prostate-specific biomarkers and combines these results with the patient's clinical information. PHI is a blood test that looks at the combination of 3 chemical variations of PSA, including PSA, free PSA, and P2PSA. Each of these secondary biomarker tests may help you gain better insight into your chances of having an aggressive prostate cancer before you decide to get a biopsy. For more information on elevated PSA and your test options, please consult your doctor.
eMedicore, core medical education. For everyone.
From everywhere.
Forever free.